Somebody's time is 6:50, and this morning we're talking about anxiety and a certain disorder that Dr. Fahd Rawra is here to give us details on. So good morning to you.
Good morning.
This is, as I said, a specific disorder.
Yes.
What exactly is it called?
So Generalized Anxiety Disorder. It's a form of anxiety disorder. Anxiety we describe as worrying, worrying constantly, worrying about one, two, several things at the same time, worrying to the point where you can't shake it off, you can't turn it off. So imagine, if you will, if a certain person likes to unwind or relax at the end of the day by either watching some TV, maybe playing a video game, or reading a book. People who are affected by this disorder will find that at the end of the day, when they're trying to unwind, that they're not really able to do that. That they're just
Is it that they can't concentrate? They're jittery?
Yeah. Well, first off, the disorder itself is making it very difficult for them to relax.
Okay.
Symptom-wise, there's several symptoms associated with this disorder. Symptoms are muscle tension. So people will feel like they're tense, maybe in their lower neck area, lower back area, problems with concentration. People complain of what we say, mind going blank. So while you're talking, all of a sudden you forget what you're going to say. Irritability. People oftentimes complain of restlessness. A lot of times there's sleep disturbances, so problems falling asleep and staying asleep.
I would imagine that diagnosis is kind of hard, because anxiety, is it or isn't it? You know, you have to find out. And what do you do to test that out? How do you know?
So basically you have to have a certain number of symptoms. It's three of those symptoms at certain periods of time, and symptoms lasting for up to 6 months. And two ways would you, I guess, distinguish it from regular anxiety or regular feeling a little stressed out and such. And that is, you know, throughout the day you're feeling or you're having these symptoms for longer and longer periods of time. So through most of the day you're feeling this way. And when you look back and you think about it, the symptom or the things that you're anxious about are insignificant or inconsequential compared to what you would normally worry about.
And going back to where they can't unwind, or you feel like, I mean, then you must have that feeling that you can't control your feelings.
Absolutely.
Or you cannot control this anxiety.
Yes.
And that must, and then they can turn to get help.
Yes, absolutely.
And what do you do to help?
Well, treatment-wise, a couple of treatments. You have the therapies and you have medications. Generally, for the milder forms of the illness, we stick with therapy, and for the more moderate to severe forms of illness, we'll do medications or a combination of the two.
All right.
And then that usually helps, right?
Yes, absolutely.
Dr. Rawra, thank you very
much
for coming in. It's good to see you, and we'll see you again sometime here with the Morning Checkup brought to you by Samaritan. We're back here in a couple of moments.